There is a new scare that's making headlines. Monkeypox. What is it? And why did the CDC just raise its travel alert to level 2? That means enhanced precautions such as wearing masks and avoiding sick people. Well, as of Monday, globally, there are 1,029 cases globally. In the U.S., there are 31 cases. Joining us to talk more about this is cardiologist Dr. Peter McCullough. You know who he is, and the author of The Courage to Face COVID-19. Dr. McCullough, glad you can join us. Thanks for being here.
Thank you.
First of all, there are 330 million people in the U.S. Now there are 31 cases, the CDC raising its level to 2, 3 being the highest. What is monkeypox, and should Americans be worried?
Monkeypox has been known since 1958 in animals, 1970 from humans. There's a paper published in MMWR by the CDC. First author is Dursky in 2018, summarizing from 1970 all the way forward to 2017, about 1,000 cases per year out of the Congo Basin, hundreds of cases outside of there. This is a orthopox skin rash. It's related to camelpox, smallpox, and cowpox. And it's easily treated with an available drug called T-pox. There was a case in Dallas last year published in MMWR by Rao and colleagues on the April 22nd, 2022 edition. The patient had lots of contact. He didn't spread it to anybody. He was treated easily with the oral drug. Just 2 days ago, another case in Dallas was reported, again treated at home with T-pox, now available orally and IV. This is spread by younger individuals. Remember, people over age 50 have been vaccinated against smallpox, so that covers them for monkeypox. So it's basically a problem of young people. Been reported in men who have sex with men. Lots of contacts. You have to break the blisters or have salivary exposure. It has nothing to do with wearing masks. It has nothing to do with public safety precautions on flying on planes, etc. That's a gross overreach.
Yeah, so it's definitely not airborne, right?
It's not. It's largely spread by this close contact. And it's interesting, in the CDC cases, even when people have a lot of contact, they don't spread it to one another, including this case in Dallas published by Rao.
So huge overreach by the CDC, as you just said. You mentioned T-pox, but what is this vaccine that the U.S. purchased 13 million doses of?
The U.S. purchased, I think, in a trigger overreaction, 13 million doses of the Jynneos vaccine, which is a live attenuated double-stranded DNA vaccine. It's only been approved based on antibody responses. It's never blocked a single case of monkeypox or smallpox. It does cause myocarditis or heart inflammation, just like the COVID-19 vaccines. And this has been shown by Keenan and colleagues and published. So we have concerns there. I think it's a gross overreaction. There's simply not enough exposure to ever warrant vaccination against a skin rash. It's better just to treat people when it comes up.
Should we be worried about another pandemic?
There's been a lot of planning. The Gates Foundation, World Economic Forum, and Wellcome Trust formed CEPI, the Center for Epidemic Preparedness and Innovation, in 2017. And this pandemic preparedness unit has a business plan, and they position every infectious outbreak as a business opportunity to produce only one type of response, and that's vaccines. CEPI has no interest in producing therapies or responding to therapies. So it looks like we have stakeholders, if you will, almost a vaccine syndicate in place to try to respond to each pandemic response, working through the treasuries and public health departments of every country with respect to a vaccine. Remember, vaccines don't treat the illness. And for rare illnesses like this, efforts are best spent just treating patients and getting people through it.
Dr. McCullough, I saw a recent ABC News analysis of federal data that shows a growing portion of COVID-19 deaths are happening among the vaccinated. But it goes on to say that this data should not be interpreted as vaccines not working. In fact, they say these real-world analyses continue to reaffirm the incredible protection these vaccines afford, especially when up to date with the boosters. Your thoughts?
No, the randomized trials of the vaccines and the observational studies in the Delta, now Omicron eras do not show sufficient protection, even against the binary outcome of upper respiratory tract illness. There are no randomized trials showing reductions in hospitalizations and deaths, none. So it's a false claim to say that the vaccines reduce severity or reduce hospitalization. What we are seeing is a disturbing trend of more and more people in the hospital who are vaccinated or fully vaccinated. Our CDC told us in December 10th of 2021 in MMWR that 79% of all Omicron patients were fully vaccinated, as really a testimony to the failure of the current sets of vaccines.
That's very scary. You know, the FDA has accepted Pfizer's application for the COVID vaccine for children under the age of 5. I think it would start at like 6 months. This clears the way for approval and distribution this month. Why do our babies need this?
They don't. And today, a letter out from both the Congress and the Senate of the U.S., led by Louis Gohmert, went to the FDA chairman. 18 signatures, again, on the congressional and Senate side, 19 hard questions to answer. And they're pointing out that probably 80% of kids have already had COVID, so it's too late for a vaccine. The vaccines are only indicated clinically to try to prevent COVID in somebody who hasn't had it. Since all the kids have basically had it and children don't have severe disease, the vaccine results in more side effects, makes the kids sicker than actually COVID-19 itself. So it shouldn't move forward in children. I don't think any good doctor or parent would have it administered to children.
Dr. McCullough, I want to take this time to talk about your book, The Courage to Face COVID-19, Preventing Hospitalization and Death While Battling the Pharmaceutical Complex.
Thank you. You know, it was an honor to pair up with best-selling author John Leake, who's a true crime author. And he has bestsellers in individual true crimes. And his timeline and analyses suggests that there was a crime committed in the global suppression of early treatment by the stakeholders who had an interest in advancing vaccines over treatment. And Americans have seen this. Americans have not seen treatment emphasized by federal agencies, by health systems, by clinics. They haven't seen any innovative protocols or outpatient treatment centers developed. The only thing Americans have heard about morning, noon, and night is the vaccine. It's clear that there has been an organized suppression of all forms of early treatment to promote the vaccine. And Americans have suffered. There's been needless hospitalizations and deaths, and we recount this in a carefully written narrative. It reads quickly. It's getting great reviews. #1 in viral diseases, communicable diseases, and true crime on Amazon.
Okay, that sounds good. Dr. McCullough, thank you so much for being so brave and on the forefront of all of this. I know it's come with a lot.
Thank you.
Yes, glad to see you.